Welcome to Capital Quality's Group 3 Orientation Webinar. To provide ongoing support for the Capital Quality On-Site Administrators, the Office of the State Superintendent of Education, in partnership with Hurley & Associates, is implementing a series of community of practice meetings for center directors and home care providers. This community of practice series is part of an ongoing effort to build capacity and knowledge as it relates to addressing the 10 quality indicators articulated in Capital Quality's Continuous Quality Improvement Plan. This webinar is an edited recording and presentation of the community of practice conducted on Friday, January 19th and Saturday, January 27th of 2018. This community of practice provided participants with an overview of Capital Quality. It also afforded participants an opportunity to discuss the environment rating scale reports, meet new quality facilitators, and engage with fellow providers. This is the first presentation in a series of presentations designed to build the skills and competencies of providers participating in Capital Quality as it relates to the Infant-Toddler Environment Rating Scale Revised, Family Child Care Environment Rating Scale Revised, and Class Assessment Scoring System Pre-K. This month's session will provide Capital Quality community updates and will serve as an orientation to Capital Quality for Group 3 providers. Additionally, it will provide an overview of upcoming professional development opportunities identified by DC Child Care Connections and the Bainham Family Foundation. Lastly, the community of practice includes information on upcoming community of practice meetings and next steps for the Capital Quality community. Just like me, as Group 3 providers, you are now joining Capital Quality and share this experience with each other. Do you share other things? Take a moment to share a professional or personal accomplishment with those around you to see if there's someone else just like you. What is a quality rating and improvement system? It's a systemic approach to assess, improve, and communicate the level of quality in early and school-age care and education programs. Similar to service-related industries, QRIS provides quality ratings to programs that meet a set of defined program standards, designed to empower families to make better informed decisions and choose high-quality environments, give policymakers effective tools to improve quality, promote accountability so that stakeholders feel confident investing in quality, give providers a roadmap to quality improvement, and promote the health and development in early care and education. The district is proud to have made significant investments in early learning, not only through the Pre-K Enhancement and Expansion Act of 2008, which created universal pre-K and sought ways to increase quality through quality grants, but also by becoming an early adopter of the QRIS almost 2 decades ago. In fact, the district began exploring a tiered rate reimbursement system in 1998 and officially launched the Going for the Gold system on June 1st, 2000. Of course, many things have changed over the last 20 years. In 2011, Race to the Top Early Learning Challenge began funding QRIS. In 2014, the Child Care Development Block Grant Act began requiring QRIS of states. This is an important movement for early learning systems. States across the country, including the district, are updating and redesigning QRIS for a variety of reasons. Reasons include growing body of research, changing population, increasing enrollment, changes in federal and local laws, regulations, and policies, unexpected distribution of program ratings, unexpected movement or lack of movement of programs up or down the ratings, investment in quality initiatives, and the implementation of the Pre-K Enhancement and Expansion Act of 2008 for 3- and 4-year-old children. This is a chart that shows going for the gold as it is implemented today alongside what capital quality will look like once we reach full implementation. This isn't something that will happen overnight, but this will give you an idea of how capital quality builds off of the work and success of the current system. The purpose of the redesigned quality rating and improvement system is to use high-quality, actionable data to inform decisions that improve the quality of early care and education. Increase the number of quality facilities to expand the number of existing quality slots for all children. Target supports and incentives around the needs of our providers, and provide consistent customer service across sectors and provide meaningful information about program quality to families and stakeholders. The district has already invested in research-based measures, the class, and ERS. We will use these tools in the redesigned QRIS to measure quality. We will also look at attendance for pre-K. We can think about attendance as dosage. How often are children benefiting from early care and education? We know that no matter how great a program is, it will have little effect if children are not attending regularly. Quality improvement will build upon monitoring for compliance in the current system to a comprehensive continuous quality improvement plan. This is a collaborative process. Programs will use their program data, including their rating, to create their own personalized plans for improvement. But you won't be doing this alone. The Division of Early Learning will provide quality facilitators to assist programs in the development of their CQIP, to help you understand your class and ERS scores, and to work alongside you to improve your program. These facilitators are experts in the field of early childhood education with practical experience with children birth to 5. The redesigned QRIS will be more than a rating. It will have 4 levels of quality built on structural quality through a strong foundation of licensing. The next 3 levels are met with standards of process quality measured by class and ERS. Our current incentives program is critical to a strong system. We plan to continue to tier reimbursement rates according to quality, while we also explore options to provide additional support. The quality profile will provide meaningful information to families and stakeholders so they can make informed decisions. This will include the ratings as well as other helpful information like a program's mission statement and program goals. The goal of capital quality is to ensure that there is an alignment across the early learning system, across OSSE support systems, and target improvement where it is needed the most. Continuous quality improvement applies not only to providers, but also to OSSE as we continue to review our policies and practices aimed at improving supports for providers. As mentioned previously, going for the gold includes 3 rating levels. Capital quality includes 4: developing, progressing, quality, and high quality. Quality rating and improvement systems have meaning when complying to the quality standards results in improved practice. Programs will receive targeted tier supports based on their quality rating so that the lower rated programs can improve the quality of classroom environments related to school readiness. The quality facilitators currently provide 3 to 6 hours per week to providers. The Continuous Quality Improvement Plan will focus on the 10 quality indicators listed. Quality facilitators will provide support based on the areas of improvement identified by the providers. Monthly community of practice meetings will reinforce these indicators and allow providers to share ideas among one another. This process is ongoing, and the CQIPs should be reviewed and evaluated regularly. Hurley & Associates have hired quality facilitators who are excited to help providers improve their program quality. The quality facilitators work closely with providers and collaborate to improve quality overall. This includes joint planning, observation, action, reflection, and feedback. This process is continual, and the quality facilitators are there to provide support. While the quality rating will not be made available publicly immediately, The ultimate goal is to share this information with the public so that they are able to make informed child care decisions. Effective October 1st, 2018, the QRIS rating for all licensed subsidy child development facilities in DC will transition to capital quality rating tiers. Programs will maintain the migrated level of quality until rated under capital quality using the Classroom Assessment Scoring System pre-K, environment rating scales, and in-seat attendance for pre-K only. The Capital Quality website is currently available. Included on the website is the one-pager Capital Quality overview in English and Spanish, along with archived presentations from year 1 of implementation. Visit the site today for more information. The Capital Quality tagline, Advancing Excellence in Early Child Education, and logo were developed in partnership with pilot and Group 2 providers. In year 1, 7 community of practice meetings were held and 2 had concurrent sessions. 5 webinars were held. Pilot and Group 2 providers have accomplished a lot in their first year of capital quality participation. All pilot and Group 2 providers have completed or continue to work on their continuous quality improvement plans and attended community of practice meetings. Quality facilitators provided at least 8 hours each month of support to participating providers, and over $150,000 was spent on curriculum materials and incentives for providers. Pilot and Group 2 providers shared their experience in capital quality with Group 3 providers in attendance at this month's orientation. My Child Care DC is currently available. Visit today for more information for families and early learning professionals. The new Professional Development Information System, PDIS, was built to replace the Professional Development Registry, PDR. PDIS will allow professionals to register for and track training, upload and store necessary documentation, input work experience, generate a resume, and gain access to valuable resources. Sign up today. DC Child Care Connections publishes current professional development opportunities within PDIS. Online training is also available through Quorum. Early Childhood Share DC is an online sharing platform for providers. Over 1,000 classroom and administrative resources, plus vendor discounts, are currently available on the site. To access the site, visit ecsharedc.org. Establish a profile, and a team member from EC Share DC will contact you to complete registration. You must have your center or home license on hand to register. By now, you have met your assigned quality facilitator. Continue to work with your quality facilitator around points of quality and in reviewing your environment rating scale data. The next community of practice will be held Friday, February 9th and Saturday, February 24th from 10 a.m. to 12 p.m. and will be focused on the class and ERS overview. Dr. Mahalet Getachew and Christina Creighton provided an overview of the environment rating scale. With questions regarding your center or home score reports, please contact Dr. Mahalet Getachew or Ms. Creighton. We are always available. Please follow us on Twitter and Facebook. Visit the OSCE website for up-to-date information. Feel free to contact Dr. Catherine Kagera or Pilla Parker for questions related to capital quality.